Issues with twin studies. Twin research assumes that monozygotic and dizygotic twins grow up in equally similar environments. However, identical twins tend to be treated more alike than fraternal twins, often being viewed as a pair rather than two individuals. This often leads to shared experiences and greater identity merging. Because of this, the higher concordance rates found in identical twins may reflect environmental similarity rather than genetic influence. This challenges the assumption that differences between twin types are purely genetic. Issues with adoption studies. Adoption studies rely on the idea that adoptees are placed into families without bias. In reality, selective placement is common. Children from high-risk backgrounds are often placed into particular types of adoptive homes. Historical studies, such as those in Oregon, likely placed children of mothers with schizophrenia into different adoptive environments compared to children without such backgrounds. This makes it difficult to separate genetic factors from environmental ones, limiting the strength of conclusions drawn from adoption research. Evaluation of genetic explanations. Support for drug treatment. One reason biological explanations gain traction is the effectiveness of antipsychotic medication, which targets dopamine activity. A large meta-analysis by Lucht and colleagues found that antipsychotic drugs consistently outperformed placebos for both positive and negative symptoms. Because these drugs reduce dopamine activity, their effectiveness is often taken as indirect support for dopamine-based explanations. Challenges to dopamine-based accounts. However, dopamine-focused explanations are far from complete. A significant proportion of patients do not respond to dopamine-blocking drugs, suggesting that dopamine cannot be the sole cause. Furthermore, some people show hallucinations and delusions despite having normal dopamine levels. This indicates that additional neurotransmitter systems are likely involved and that dopamine abnormalities are only part of a more complex picture. Evaluation of neural correlates. Evidence for gray matter loss research consistently links schizophrenia to structural differences in the brain. A meta-analysis by Vita and colleagues found that people with schizophrenia showed greater loss of cortical gray matter over time than healthy controls, particularly in frontal, temporal, and parietal regions. These changes were most rapid early in the illness, matching the typical onset in late adolescence or early adulthood. Implications for early intervention. Understanding neural changes has important clinical implications. Detecting structural abnormalities early may help identify people at high risk of developing psychosis. Large-scale projects, such as the North American Prodrome longitudinal study, use neuroimaging and other assessments to predict future illness. This supports the idea of preventative treatment, where early detection of brain changes could allow intervention before full psychosis develops.